Hello and welcome to Genomics Gupshup. Genomics Gupshup is an initiative by MapmyGenome to create a community around genomics and to simplify genomics for everyone. And we do this by bringing together experts from allied areas like medicine, genetic counseling, nutrition, fitness, and more. Please join us as we spread the word about this exciting science of genomics. We are now available on your favorite podcast as well. Just search for Genomics Gupshup on Apple, Spotify, Amazon, or Google Podcast. Today is our 40th episode, and I'm so glad to introduce you all to Dr. Sahitya Bammidi. She has more than a decade of experience in obstetrics and gynecology, and she's one of the top gynecologists in Hyderabad. She's an expert in complex laparoscopic surgeries with a special interest in infertility and high-risk obstetrics. She's got a lot of different honors. Many different societies have recognized her contribution. I think, I was particularly impressed with her prestigious APJ Abdul Kalam Medical Excellence Award in 2021 for her contribution to the medical field during COVID-19. And she's also awarded with an honorary fellow of the Indian Academy of OBGYNs in 2017. So welcome to the show, Dr. Sahitya. We are so excited to have you today. And we hopefully we can discuss a variety of different things because you specialize in so many different areas.
Thank you, Ms. Anu. It's a privilege for me also to join in this program with MapmyGenome. So I'm overwhelmed with this opportunity.
Thank you. So, Dr. Sahitya, let's start with, why did you choose to become a doctor and in this specialized area of aesthetic gynecology? First of all, we don't even know what aesthetic gynecology is, right? So maybe if you tell us about yourself and then a little bit about what is aesthetic gynecology, how does this impact the average person, that would be great.
Yeah. So first of all, with your question, like why I became a doctor. So that's a long story actually. So it's my parents who were doctors, and in my family, like everybody wanted me to be a doctor, and so I became a doctor. So
medicine in your DNA.
that. Yes, yes.
Yeah.
It's as simple as that. But coming to the aesthetic gynecology, so aesthetic gynecology is the new branch of ERA, which is a new branch coming up in gynecology. So it's a sub branch of the gynecology. So how the infertility and I think there are a lot of sub branches in the gynecology. So the same way, the aesthetic gynecology also is playing a very important role nowadays. So this aesthetic gynecology branch particularly deals with the female sexual dysfunction, like sexual practices or sexual dysfunction. If women is having complaining of some amount of dyspareunias or in their early marriage or after the marriage also, there are like a lot of women who doesn't want to actually involve in the sexual intercourse. So and there aesthetic gynecology has a very important role in the stress urinary incontinence also. It's not just the appearance, like how it is showing up as an aesthetic. It is not actually an aesthetic part. There is also a functional part also in this branch. So if a woman is experiencing a stress urinary incontinence, which is very, very uncomfortable for her to go into the social gatherings or social places where they doesn't want to actually go with it. So that is where actually this aesthetic gynecology plays a very important role, where they deal with the laser training or laser procedures, where we can actually tighten up the vagina for the betterment of their, their normal life, to get back to their normal life, to be frankly speaking. So that is all about the aesthetic gynecology. As the name says, that it is actually, I have to tell that it is a misnomer rather than it's a just not the external appearance what we see. There is a lot of functional part what we deal with it also.
So how do when do women or girls, they know that they need to come and visit you, right?
Yeah.
Some of them may be educated, but if, let's say, the average person is not educated, what would be like the top 2, 3 things that they should watch out for before they come and see you?
Yeah. So first thing is basically every women are having so many misconceptions about their external appearance, like how they actually feel that they look like. They also feel like the genital organs, the external genital organs also. It's a like it's been like a long term problem that has been inculcated in our daily practice actually. So the vagina have to be look like this, the external genitalia have to look like this. It's not like that. So there are a lot of misconceptions even in the society, that the vagina have to look in one particular way. That is very wrong misconception that so many of us are having in that. So first of all, that has to come out of their mind. For that, they need to go for a counseling. So sometimes, like, if their partner might be telling that there is some problem in your genitalia, so please go and visit your doctor. So there are so many what do you say, that the misconceptions in the society, that it should look like this, it should be like this. So first of all, that misconceptions have to be go out of their mind. So that is the first and foremost thing what they have to do it. And the counseling plays a very important role. And third one is, if they are experiencing some female sexual dysfunction, like some desire issues or some problem while having their intercourse, pain while having their intercourse, so that is when they need to meet their gynecologist, or they need to meet their aesthetic gynecologist for the, I mean, for what can be done. So there are some issues like where the labia or the external genitalia will be in a one particular way, which can be rubbing with the friction or some problem they might be facing. So because of that, it is actually very itching, or some skin issues also, dermatological issues also they're facing since long time. So that is when they need to meet their aesthetic gynecologist. And the third most important thing is, if they're experiencing some urinary incontinence problems, like if they are involuntary passage or involuntary leakage of the urine while having the intercourse, or while coughing, or while sneezing, while laughing, if they are having an involuntary passage of urine, that is when they need to meet their aesthetic gynecologist. So there are some places where they need to go to an aesthetic gynecologist and need to get treated. There are some places where they have misconceptions because of the societal I mean what do you say, that
Patients.
yes. So that is when they need to go and go to a gynecologist and have a proper counseling, have a proper discussion with their gynecologist before going to any procedure, before having, because they might be seeing in some Google or something else, like where they have like lot of misconceptions about this. So first of all, they need to clear up their idea, what is their problem exactly, what they wanted to have it, and what can be done the best way.
And I guess, coming from a genomics company, I think one of the first things that we think about a lot of times, surgery, which is done like a mastectomy or otherwise, where you are voluntarily removing certain things because you want to prevent certain diseases. Is that also something that you see quite frequently, other than the aesthetic, for whatever people want to do, or the incontinence and other issues? Do you also see that a lot of times there needs to be an intervention because of a genetic reason that you find in your patients? Or?
Yeah. So this is a very good question, because lot of women or lot of people are, I mean, they might be hearing a lot of news saying that women who are positive for genetic testing, they have to go for some surgeries like mastectomy or hysterectomy with bilateral salping, oophorectomy, these kind of procedures. So this is when the genetic testing plays a very important role. So there are some prerequisites or some places where you have to go for a genetic testing without any delay or without any thought about it. So like if there is a strong family history, like in the first degree relatives, like in your mother or in your sister or in your brother having some breast cancer or the ovarian cancer, and even some amount of endometrial cancer like Lynch syndromes, and there are some kinds of syndromes where almost 15% of ovarian cancers and 10% of endometrial cancers are genetic in origin, to be frankly speaking. So these are the women. First of all, they need to know their history, their family tree, what is happening with them. So then they need to go for a counseling, go for the testing, and soon after the testing, if they are negative, that's a different story. If they are positive, they definitely need to go with the risk reducing surgeries, like cancer risk reducing surgeries. So that can be a simple mastectomy, that can be a total abdominal hysterectomy or laparoscopic hysterectomy with bilateral salpingo-oophorectomy. And it also has like very important role in the fertility sparing, and whether they they need the fertility in future or do not need their fertility in the future. All these play a very, very important role. So first of all, there is nothing to get panicked that if the test comes positive, what's next? Or if I go for a test, if it is like what's next? So before going to any kind of testing or any kind of procedure, they can visit their gynecologist or a genetic counselor or an oncologist who are trained in the gynecological surgeries or genetic surgeries particularly. Then after a proper counseling, they can go for a genetic testing like BRCA1, BRCA2, and some PTEN mutations like that. And there are some syndromes where they can run in families also. So whether they are autosomal dominant or recessive, all these conditions will be clearly explained to them by a gynecologist or a genetic counselor or an oncologist if they are meeting them. And after that, they have to go for a proper testing from a proper center. And soon after that, if it is a negative thing, that's a different story. They can just go visit their whoever the prior clinician who they have met before. Otherwise, they can go for a procedure soon after the test if the test is showing positive. There is nothing to get panicked about it, because they say that almost 80 to 90% of genetic cancers can be reduced with the testing initially, followed by a proper and particular treatment pertaining to that particular cancer.
And I think people need to know that when you do test, you are likely to reduce your chances of getting that, because I think a lot of times these cancers are discovered quite late if they didn't find it. So I think, maybe if, I mean, of course, I'm familiar with what mastectomy and hysterectomy and others are. And maybe if you can just explain to people what does that mean, and what actually, what are you doing as a surgeon? What do you all actually do? And is there ways that people should not be worried about, a certain part of their body being missing, because there are many reconstructive surgeries as well?
So first of all, we need to understand a situation that if something comes like this, like if the genetic testing is positive, it's not just the gynecologist, it's not just the genetic counselor, it's not just the oncologist who will be dealing with that condition. It's a multidisciplinary approach where the gynecologist, the oncologist, the genetic specialist, and the mental health specialist, like the psychiatrist, and the whoever the allied branches who are actually in related to them will be there with them while doing the counseling, because they might be having a lot of doubts about this, like whether they need to go for the surgery, if they are going with the surgery, how much risk they can reduce getting that particular cancer, whether they have to go for further screening procedures or not. So after, if they are going with the screening procedures, is there any other kind of cancers where they can get? All these doubts might be arising to every woman or every family who are having this genetic testing, and next what, like whether their next child or next girl child or next male child, whether they have to go for this testing or not. So all these will be done in the counseling process. So after doing the counseling process, if they are okay to go ahead with the procedure, as I already said, with these procedures like cancer risk reducing surgeries, that is what we call this as. And if we are doing a bilateral bilateral salpingo-oophorectomy is nothing but where we actually, so in a female internal genitalia, they have a uterus, they have a tubes which are connecting between the uterus and the ovaries, two ovaries will be there. So in risk reducing bilateral salpingo-oophorectomy, we will be taking out the tubes and the ovaries, because here the fallopian tubes are the culprit of the disease. So that is the reason why we take out the tubes and the ovaries together. Okay, so and obviously after removing the tubes and the ovaries, it all depends upon the uterus. So uterus, usually if there are some mutations like BRCA1 and BRCA2, it's just the ovarian cancer and the breast cancer, and to some extent the gastrointestinal cancer. So there, the main risk reducing surgeries are the mastectomy, risk reducing bilateral salpingo-oophorectomy. Only these two surgeries are required. That's all. There are other problems like Lynch syndrome or some P10 mutations or something like that. So in that situation, we actually take out the uterus and both the tubes and the ovaries. Depending upon their condition, depending upon their problems, we usually plan the treatment or plan the management. So it all depends upon their genetic testing results. So what kind of history they are having, what kind of genetic cancers they are having, and what kind of tests they have went through, and what tests are showing positive. It all depends upon those results. So depending upon the results, our management depends. So it's as simple as that.
So I guess, gynecologist pretty much for most women becomes their primary doctor, because you go through so many.
We are like the first hand doctors where they can meet us and go with the, next what next.
Well, yeah,
comes from us actually.
Correct, because you start with like teenage years when they are going through the first set of hormonal changes. Then you're having babies, you're then having menopausal issues and so on. So I think with all of these, I think if people can get a better access or more personalized approach. So in your case, let's say a child like a 15-year-old comes, is there a process that you use to create a personalized approach for them, or is it a more, I have a problem and I therefore seek a solution?
Yeah. So we usually the teenage girls, or as you said, a 15-year girl, if she comes to me, we say this as an adolescent gynecology. So adolescent is nothing but not completely a child, not completely a adult kind of person. So here they can face little problems, like they are newly into the puberty. There are new changes that are happening in their body. There is a little time for the hypothalamo pituitary ovarian axis to get matured. There are some issues like amenorrhea, like they are not getting their periods regularly, white discharge PV. There are certain problems pertaining to that particular age. So depending upon their problem, depending upon their situation, usually our diagnosis or our investigations or our management all depends. So for example, the PCOS, like it's becoming very common nowadays. So it's been like almost, if I see 10 in my everyday outpatient department, usually I see almost 7 or 8 suffering with this PCOS. So these are the women actually who require proper counseling. This is when the lifestyle modifications, exercise, and weight reduction plays a very important role. That should start from the adolescent group or the teenage group. So basically, if you are, if you are putting this healthy lifestyle or avoiding the junk food or something like that in this age group, this is when which will improve the future generation also. So maybe if I counsel them, if I talk to them for 20 minutes or 30 minutes regarding that, that might help in future not to have a PCOS or an infertility or an endometrial cancer also. Because there is a study now saying that PCOS women are the ones who are more prone to have an endometrial cancer in the later on years. PCOS with the obesity, with diabetes, with hypertension are the risk factors where they can develop an endometrial cancer in more than 50s or 60s. So that is how the counseling plays a very important role. The time what I spend with the patient, with the girl for a quality time, what I say. So quality time is what it is important nowadays, to spend with them and talk to them in such a way that they inculcate this healthy lifestyle into their daily routine, which can prevent a lot of diseases in future. So this is what we call it as a primary prevention. Before coming the disease, we are trying to do something to prevent that disease to happen to them. So that's how.
And I think, one of the things that we can help over there is to say that, a lot of times because of your genetic makeup, you are predisposed to certain things.
Yes.
But lifestyle can counter a large number of those. So when we are doing, whether it's a genome patri or an oncomap, we are pretty much doing that, where we help people understand that maybe you can, even a 12-year-old or even earlier, sometimes the early menarche or other things, these are all genetic mutations that predispose you. So I think, if people go to a gynecologist upfront, have that discussion, I think the chances of them changing their lifestyle are higher. And as a result, I think we see that, they'll, over the next few years, they're likely to have lesser number of problems than what they're probably, facing now. Because a lot of times people go to see a doctor quite late. And I think that's one of the big challenges, that people have they think that if they go to a doctor, they'll find problems. And I say, you have a problem and therefore it will be found. It's not going to be found without a problem being there.
Yes, true.
Yeah. So where you mentioned for young children and 15-year-old adolescents and others. And do you also see that for people who are looking at fertility and looking at early this thing, how do you look at genetic testing for fertility and other such cases? So for instance, we see a lot of parents who had a child that was aborted early, and then they come to us and then they do counseling. Do you see a lot of that happening as well, that because of their genetics or otherwise, they could have prevented something like that, right? Of course, early or later.
Yeah. So actually, as you said, Anu, actually genetics plays a very, very important role in every part of our life, actually, to be frankly speaking. So when I talk to you, when I spoke to you about the PCOS, so definitely the history is what it is important. So if the girl's mother is obese, or if the girl's mother is having some amount of GDM, like gestational diabetes in the pregnancy, or if the girl's mother is experiencing some kind of problem in her adolescent age, definitely that genetic makeup will have a very, very important role in the child now. And that is what it is carried it to the girl now. And that is what it is expressing it right now. So this genetics is the study where they have a lot of scope, actually, where we need to extend our I think we need to actually concentrate on this genetic makeup or genetic this thing, like genetic studies, where we will be knowing it much earlier what they are coming for, and maybe we can treat it in a better way. So I think this is the future right now. So maybe like what in for a woman who comes to us with pregnancy, if the baby is less for gestational age or a small for gestational age, we ask their history, like whether their what is her birth weight when she delivered, or what is her husband's birth weight when he delivered, because that is how the genetics plays a very important role in the even in the pregnancy or in the fertility. So even in the infertility also, if there is a sister having the fertility issues, definitely this woman having a fertility issue is quite larger than a normal person who is not having a history. So definitely the genetic makeup plays a very, very important role in either in the fertility or in the pregnancy or in the some adolescent gynecological problems, anything. I think to some extent there are a lot of cancers, everything, the genetic plays a very, very important role. So, we need to extend our studies and we need to do more and more studies on this, because the Western world are already like doing a lot of research on this in genetic, how the genetic makeup and how the genetics happening, and whether we can do it prior to the pregnancy only, like what all diseases can be detected during the pregnancy, like what are risk factors that they can go through it, and what medications we can give to prevent those diseases. So we need to have more research on this, and we need to actually work on that way, so that maybe you guys can help us with that, to actually put that in right place at right time actually.
So I guess, at least the way I look at it, I think people can find out earlier before they choose a partner.
Yes.
Because there are certain mutations that are okay if you have it, but if you and your partner have, you're passing it on to your child. And then, of course, there are other genetic challenges that can happen, or the other more common ones nowadays that you do in the prenatal case, like a NIPT or those kind of tests. And I think, of course, even post newborn testing, because you're finding that more and more, some simple interventions, even in those cases, I think can change how a baby's life is going to be.
Yes.
So I think all those are, a lot of great things coming. But you said a very interesting thing about, gestational diabetes and some of the things that the mother does that influences the child, right? And one of the other area that is that we are now able to study more is the whole epigenetics, which is not your genetic code, but what your environment has done, right? So whether they say that, doing yoga is good for, for a mother to do yoga or meditation and things like that. What is interesting now is that from a genetic point of view, we are able to actually see those changes even in the babies, and you're preserving some of that. So I think a lot of interesting things are now coming up. Yes. But what are your thoughts? I don't know if you have done any studies right now. A lot of the diseases are also connected to the gut microbiome, right? So your gut is, it's not just a gut feeling, but you're also seeing that a lot of times you are seeing that, your diseases can be also seen in a gut. So do you also think that that is something that would be interesting from where you are, your standpoint?
Yeah. So most of the, yes, gut microbiome plays a very important role in some of the infections actually. So they say that like now the recent research were going up on that. So gut microbiomes are the ones which plays a very important role on the vaginal infections. Okay, so like what we eat or what the microbiology of that gut or gut system in the women has a role in the vaginal infections also. So if there are recurrent vaginal infections, recurrent bacterial vaginosis or something like that, we to some extent tell the women to have the whatever the
probiotics,
to improve their probiotics or to improve their gut microbiomes actually. So in that way we prescribe some amount of probiotics also to reduce this vaginal infections, and to some extent the chronic pelvic pains. That is the most dreadful condition, like even though it is not spoken about very I mean, very lately, like they don't speak about it, but that is the like unusual thing where the women feels the pain between in the pelvic region, where they have this discomfort in the pelvic region, but still we don't see any cause. So where the IBS and all these plays a very important role. Even though we do a laparoscopy, we give all the management, but still women says that the pain is not reduced. So this is where, this is where the gut microbiome or these all things plays a very important role. So I think the research they are taking very faster way. I think in the near future, the probiotics will be the treatment of choice for lot of infections or lot of undiagnosed diseases. Like, I mean, even though it is negative, if the women says that it is there, that's all. So for that, we need to treat them. Maybe in that there is a very important role of this gut microbiome or probiotics or whatever it is.
So we've been doing these tests recently, and just fascinating, but I did it a few times. And it is quite interesting because earlier you could not do much association with, specific diseases. So even, you mentioned a lot of times you'll do a multidisciplinary approach for a lot of disease management. And what was interesting was also stress and depression and other things. I think that also is showing close correlation with your gut microbiome and other things. So I think in the end, I think over the next few years, we'll see a lot more clarity over there. And we'll see that the probiotics that we are seeing will be more specific to that particular problem, right? So, you can see which bacteria are causing those problems and therefore give that. So definitely for sure, I think infections are one great place to fix that. But the other associations are also becoming quite interesting, at least to my view, that if we can fix your gut, you're fixing some of your other challenges. Maybe over the next few years, we'll see a lot more interesting research coming out in that way.
True.
So I know that we are taken up quite a lot of your time, but I wanted to maybe ask you a few quick questions. What is prevention according to you? I think you kind of answered it, but in your...
Yeah. So actually prevention can be of two types, actually, primary prevention and the secondary prevention. So primary prevention comes when the disease is not yet started, but we are doing something which can reduce that disease to come. So this is where we imply or where we inculcate the lifestyle modifications, reducing the stress, depression, mental health, all comes in this primary prevention. Secondary prevention is the one thing where the disease has already come and we are doing something to prevent the disease, like prevent some bigger problem not to happen. So anytime the prevention is better than cure. So we need to actually concentrate on this prevention strategies rather than curing the disease strategies. So maybe what we already spoke about, like the probiotics and the diet and the stress management, mental health management, and to some extent our yoga, meditation, all these plays a very, very important role, and healthy lifestyle. So even though it's not just like if you are doing an exercise, it's not just to reduce your weight. It improves your mental health. It releases some good hormones in your body, which improves your mental health. That in that way, it prevents a lot of diseases. It makes you happy. Like it releases a few nicer hormones in your body. So that is how the prevention plays a very, very important role. I feel as the old saying says that prevention is better than cure. So we need to actually work on these prevention strategies rather than curing a disease.
I think I really like you said that, when you exercise, you get happy, and happy hormones bring you, can fix some of your disease issues. Obviously, I think you are in the aesthetic gynecologist field, but what is healthy aging according to you? and how do you prevent aging? I'm sure in some ways you are doing that, but what are
Yeah.
your thoughts?
So in my view, age is just the number. It just ages, but it's all in your brain and it's in your head, like whether you are aging or not. So it all, like how you behave, how you actually do your I mean, plan your day, that all depends upon your aging. So if you are improving your lifestyle with your healthy habits and healthy practices, balanced diet, exercise, all this, like I think nowadays, like government have been introducing few runs. Like I think every Sunday in Hyderabad, we are having either of the run, 2K run, 3K run, 4K run. Why these are all happening? These are all happening for a cause, actually. So these all help us to improve our lifestyle, improve our to inculcate that healthy habits in our daily routine, so that some diseases or some things can be prevented. And it doesn't just depends upon your age, it all depends upon your mental well-being and mental health also. So it is your preview, like it is your attitude to how you are acting for a instance to happen. Like if something is going wrong, like how you are reacting to that incident is what it matters, rather than it's just an it is just the number, is what I feel at the end of the day.
So would you like to live to 125 years?
Yes, obviously. I do. I think I'm already living that.
Oh, great. Uh, so what, I'm sure you are in the, you deal with a lot of taboo subjects in many ways, right? So what are some of the myths or things that you normally think that are pretty prevalent in our society? Do you think there are some that are pure myths that are being propagated by different people?
Yeah. So one thing is the most, I think, for the vaginal infections, they will be using some kind of washes or something to avoid the infections. So that is a proper myth. So vagina itself is it's a self-cleansing organ. Like how the mouth produces its saliva, vagina also have its own glands, which produces the discharge. So discharge is normal, but if it is abnormal, you yourself will know that. Please do visit your gynecologist as you find some abnormality if you are facing when you are seeing a discharge which is not clear, which is associated with itching, where you are having some soreness or burning in the vagina, or when you are having pain while peeing or while defecating. So that is when you need to meet your gynecologist. There's no point of using washes or anything like that. Simple plain water can clean your vagina and the external genitalia as good as it is. So nothing extra can be used to clean your intimate areas. So that is one thing. And the second thing is, I hear a lot of myths about eating egg in pregnancy can make your child bald.
What? I didn't hear that one.
Yeah. So that is like, I think in the recent time, that is the most
Interesting.
interesting myth which I heard, actually. So protein, egg contains protein. Protein is very good for your health. In the pregnancy, you are bound to take more protein diet. That too, the balanced diet will make your baby and you more healthy. So there is no myths like that. So don't hesitate to take an egg a day. So even I think government also have introduced under, like every day you need to take one egg per day. So either if you want to take 2 eggs per day also, it's fine. That doesn't make your child bald. So that is one more myth. I think the third myth is with the periods, like the menstruation. So they have like lot of taboos with that. Like using a menstrual cup can actually tear your hymen or something like that will lose your virginity, or using I mean, when you are in when you are menstruating, you shouldn't go to a temple, or you shouldn't do that, this, don't sit on a chair. There are a lot of myths. I think nowadays the social media is like very I mean, they were doing lot of educational reels and this thing with this menstruation. So menstruation is a normal physiological phenomenon. Every woman will go through. Your mother, your grandmother, you, your child, everyone will go through this menstruation, and menstruation is a normal physiological process. It lasts for 3 to 5 days, where you can change your pad or a cup, or menstrual cup, or menstrual whatever, like whatever you are using it, use it in a proper way, in a hygienic conditions, and that will take care of all your menstrual health. So that is what I can tell you. I think these are the 3 myths in each area where I can tell you. So if you hear any kind of myths, I think you can ask me.
This is a fascinating, interesting one. I think the egg one is going to stay with me. So in your view, what is digital health? Digital health. Like, do you think that
digital health, yes,
you've seen a lot of apps and a lot of
yeah,
things that people are coming up with? And I think one more interesting thing you mentioned was that of reels and other things. And I think recently there is a government has put a ban on this.
yes,
So,
yes.
and what are your thoughts on that? I think it's, I mean, I
Yeah.
think it's great, but
yes, yes. So first of all, social media have pros and cons with that. So we need to agree with that. There are some people like who are not trained in that particular area, are actually doing lot of things which are not pertaining to their their area, or whatever it is, area of interest. So I think if it is related to the medical health or medical thing, I think it's better you meet a gynecologist, or you meet a doctor and have a proper opinion about it. So whatever they are giving it in the social media, it's like a total view about it. It's not particularly something, because each person is different, each genetic problem is different, each genetic makeup is different. And I do say this very often. So taste differs from person to person, and sometimes within the same person. Okay, so in the same way, each person is different, each person genetic makeup is different. So you cannot just go with the reel and take the management over the counter. You have to go and meet your gynecologist, or whoever it is. Like, go and meet a doctor, discuss your problems, uh, find out your doubts, and then go with the medications. So I completely disagree with the over the counter medications. Whatever the education your doctor is giving, your whoever digital health, whoever are propagating it, they are giving in a bigger view. Actually, it is not just
generic,
particular to your own health. You might be having some other problem where you need to get evaluated and treated. So please do visit a doctor if you are having a problem, rather than going to a some social media thing and going for a reel and just applying that into your health condition. So that is all. I think to some extent, education, this is very much needed, because I think a lot of women are coming out and they are having their own social media business and everything. That is very good, and that I'm very happy for them. But at the same time, please understand this situation also. It is not particular to your own condition. You might be having some other condition. Particularly if it is your health, please do visit them, because I think in the COVID times, the online consultations and everything were very in very high numbers. But now I think you can go and meet your gynecologist, or meet any doctor, like whoever you want to meet up with, and discuss your problems, I think that will solve a lot of issues, I mean, regarding to your particular health.
So I guess one size doesn't fit all. So don't take
Yes.
what is said in social media for granted, because you can find out based on your genetic makeup, based on who you are, how you can be treated. Because ultimately it is all connected. Lots of things are connected, and you don't know if what is true for one person is true for the other. Right. So is there anything else you want to say, or I will move to the rapid fire, which is a quick round.
Nothing much. I think I have covered a lot of things. I think we have discussed a lot.
So what is the most common complaint about you by your friends?
I think my friends doesn't have any complaint with me.
That's
the
good.
only thing what they complain about me is no time, actually time, which I don't give it to them. So they tell one time and I go some other time. So I think we have the time issues. That's all.
What is your favorite food?
Now I became vegetarian. I think now it's paneer. Before that, it was biryani, obviously.
It shows you are Hyderabadi, I guess.
Yeah.
What is your favorite place to travel to?
Travel to, I think I have to go to Paris. So that's this thing. And in India, it's Kashmir.
Wow. So Paris, I went twice this year. So I also
Nice.
found that in my genetic makeup, there's a little bit of French this thing. So I just justified it based on that.
Nice. Then I also have to check my genetic makeup.
Maybe you don't know. There's some Kashmiri and
yes, somewhere. Yeah.
So what is something that you'd like to do more of and something you'd like to do less of?
I want to actually watch movies. I'm very, very fond of movies. So if I get time, I'll just go into the theater and watch movie. If my mood is not good, I go to movie. And movie and music are like my favorite things which I do.
Great. I think with that, we come to an end for our episode number 40. I think it was great. I think we were able to touch so many different areas. And I know that we can speak for a lot longer, but I know that you also have a very busy practice. So thank you, Dr. Sahitya. It was absolutely an honor to have you on this show. And hopefully we'll get to meet you in person soon.
Yeah, soon. Thank you. And it's a very great privilege for me also to actually be in this MapmyGenome Gupshup program. Actually, I'm really very thankful to you also.
Thank you.
Thank you so much for giving me this opportunity.
Thank you.